Hi, Nadia.
Hi.
Hi, Dr. Bhopal.
Hi there.
So it's nice to have you here. I'm really, really excited to have Dr. Nishi Bhopal on our podcast today. We have a lot of questions about sleep, and I know it's a super hot topic, and this is her specialty. So, a little bit about Dr. Nishi Bhopal. She is board certified in psychiatry, sleep medicine, and integrative holistic medicine. She's the founder of Pacific Integrative Psychiatry, an online practice based out of California, where we are too, well, where I am, where patients receive a whole person approach to anxiety, depression, and sleep disorders, including nutrition, psychotherapy, and integrative and functional medicine. In addition to her private practice, Dr. Bhopal is the founder of IntraBalance, an educational platform for physicians and therapists that includes a YouTube channel and online courses on clinical sleep medicine for healthcare practitioners. And her passion is making clinical sleep medicine easy to understand and accessible to all. So we are really excited to have Dr. Bhopal with us. I'm going to pass the mic on to Nadia, who has few questions for you.
Thank you so much for coming on today. Before we get a little bit into what we talked about during me and my mom's last conversation about sleep, I was wondering if you could tell us a little bit about how you decided to become a psychiatrist and specifically a sleep specialist.
Well, thanks for having me on. Yeah, I can share a little bit about how I got into psychiatry and then sleep. So, when I went to medical school, I actually didn't intend to become a psychiatrist. I went to med school thinking I was going to be a pediatrician. And once I started doing my rotations, I kind of realized pediatrics wasn't for me. But I was one of those students when I was in university and then in med school, I was interested in everything. So I found it really hard to narrow down, like in university, like what's my major going to be? Like, I don't know. I want to study everything. I like studying English and biology and like anthropology and all of these different subjects, languages.
Mm-hmm.
And so the same thing happened when I went to med school. I kind of liked all of the specialties. So I ended up choosing internal medicine actually when I started out my specialty training because I thought, well, that kind of includes everything. You get a little bit of everything, and it's sort of general enough to keep me interested. But then when I started my internal medicine residency, which I did in Michigan at Henry Ford Hospital in Detroit, I realized that I was like sitting with my patients and I'm talking to them about their lives and what was going on in their home lives and their relationships. Did they enjoy their work? Did they find it meaningful? Like I'm asking them all these questions. And my attendings, my supervisors were like, you can't spend that much time with every patient. Like, you have so many patients to see. Like, you can't be doing that. And I was always interested in psychiatry. And so there was a moment where I was like, okay, I think I need to go into psychiatry. That's probably a better fit for me and my interests and how I like to practice. So I ended up switching into psychiatry after my intern year. And then when I was in my psychiatry residency, I started getting really interested in sleep. And one of the reasons for that was one of my senior residents was going into a sleep subspecialty, which I didn't even at that time know was a thing you could do. I was like, sleep? Like, what? You can study that? And so I learned about sleep being this whole specialty in the field of medicine. And I got really interested in that because I personally had struggled with some sleep issues, which we can talk about as well. And yeah, so it was kind of like this accidental journey into psychiatry and then into sleep.
That's really cool. I feel like a lot of the people we've talked to recently, their specialties end up it's not something that they intended on specializing in, but they found their way there, which is I think really cool. Um, so getting more into what we talked about in the last sleep episode, what do you wish college students knew about sleep in general?
Yeah, so many things. I mean, it's kind of the stuff that I wish I knew when I was in college, about sleep, because I was one of those students where I had to drag myself out of bed to get to class on time. I was so tired all the time. I remember sitting in one of my afternoon English lit classes and like barely being able to keep my eyes open. I was so sleepy and like my head was nodding and like I jerk awake, like embarrassing, in the middle of the classroom. And I did not understand the importance of sleep at that time. I was burning the candle at both ends, staying up late, writing papers, or just doing whatever, hanging out with friends or whatever, not really focusing on sleep as a priority, and then trying to catch up on the weekends or catch up on holidays. And that just did not work for me. So I was chronically sleep deprived. And so that's one thing that I like really want to emphasize to any college students listening, is that you need to prioritize your sleep every day. And I know it's not always possible to get, that exactly every day. You have exams and you have papers and you have all these things to do. You have a social life, but you can't really make up for that lost sleep if you're sleep deprived all the time and then you're trying to catch up on the weekends or on vacations. It just doesn't work that way. And it's a recipe for difficulty with memory. So studies show that if you are thinking about either staying up late to study or going to sleep, people who actually prioritize sleep do better on their exams than the ones who pull an all-nighter. So it's really important for your memory. It's also really important for your mood regulation. So if you find yourself getting like really anxious or emotional or irritable or snappy, or like you're just like all over the place emotionally, that could be from lack of sleep. And oftentimes we don't make that connection.
Yeah, I feel like right now, I feel like this is a problem that I've been dealing with. I'm not very good at prioritizing sleep. I feel like sometimes I think of it as like something that's like getting in the way of other things that I want to do, which is obviously not healthy. But I've been trying to, be more mindful about how I think about sleep and just how it affects me and my well-being the next day, just and for the rest of the week. And I know my mom also has a question, but this what you just talked about kind of goes into what I was going to ask later on, because my dad is an inpatient pharmacist, so he's worked graveyard shift for over 20 years, and he usually tries to get like that extra sleep on the weekends, to make up for what he didn't get during the week. And yeah, I don't know how does that mentality of, trying to make up for sleep that you didn't get, how does that affect your health in long term?
Yeah, such an important question. And, in the short term, you might be able to catch up on a little bit of sleep. So let's say, you had a night where you just couldn't sleep as well, or like maybe you were traveling or something and you sleep a little bit extra after that to kind of make up for it. You can kind of do that. And it's not like it's really bad for you, but what can happen is with ongoing sleep deprivation, it's really not possible to make up for that in the long term. Now, shift work, like your dad working these night shifts in the hospital, that's a different beast, or it's its own beast kind of altogether.
Mm-hmm.
And there's this whole sleep disorder called shift work sleep disorder, where when people are working night shifts or they're working different kinds of shifts, it does have an impact on their overall health. Um, Short term, it can cause like more sleepiness during the day. Some of those other things we
Mm-hmm.
talked about, like irritability, mood dysregulation, problems with memory, lack of energy, or just difficulty sleeping when they're off work because their schedule's all messed up, right? Their body clock's messed up.
Mm-hmm.
Long term, we know that when people work shift work, they do have a higher risk of health issues. So things like certain types of cancer or GI issues, increased risk of heart disease, mental health issues like depression, and then safety issues as well, right? So like car accidents and that kind of
Mm-hmm.
thing. It's interesting though, because there are some people who are well suited to working shifts. There are some people whose body clock just kind of naturally adjusts to shifts.
Mm-hmm.
And there's people who don't. Like when I was working shifts, when I was in my medical training, like you have to do shifts. You have to do night shifts, or like you have these
Yeah.
really long, shifts that you have to do. Like I was shattered. Like I could not do them. Like
Mm-hmm.
I was like, there's no way I'm going to do this when I graduate. Like I need to work
Yeah.
like just a normal hour job, because I know personally, like I couldn't adjust, but there are people who
Mm-hmm.
can adjust. So hopefully your dad is one of those people who's like
Yeah.
is able to manage. Yeah,
Yeah.
it's tough situation.
Yeah. I feel like honestly, I don't know. I looking at it, I do not think I could do that either. But I feel like he's done it for so long that it's just like I feel like if someone were to tell him that he had to do the opposite shift, he would not do well with that either. So I don't know. It's very interesting.
Yeah,
Yeah.
he's a pretty good, like, he adjusts well, you know, like it's I think we pretend or we joke that it's his talent, that when it's his time to sleep, you can just tell him sleep here, like anywhere, and he'll just go to sleep. And then when he has to wake up, he wakes up. I don't know. And it was when we first had Nadia that he shifted to working graveyard, 9 a.m. to 9 p.m. Sorry, 9 p.m. to 9 a.m. He does 12 hours in a row, 7 days in a row, and then he gets 7 days off in a row. And he really likes it. Like, he's not forced to do this shift anymore, but he really likes it. I think he doesn't feel too sleep deprived. And I hope that it is okay for him long term health wise. But we're yet to, we have to see how he does. But he seems to be doing fine. Okay, so like I said earlier, sleep is a hot topic, and it seems like everybody has like their tips and advice and things that they've picked up on the internet. Um, and I have a habit that I do before I go to sleep that supposedly is not good, which is I'm on my phone right before I go to sleep, which is like a bright light in my face right before I go to sleep. And I specifically, like, my pattern is I do a Wordle, a mini crossword, a new game called Connections, and then I start to read my book, and then I get sleepy, and then I go to sleep. That's like pretty much my pattern. I look forward to that every day. Is it a bad idea for me to be on my phone right before I go to sleep?
So I think we're sleep twins because that's exactly my pattern too. I do Wordle and the mini crossword, then connections, and then I do Letterboxd. So,
I do letterbox if I'm not happy with my performance on Connections.
yeah, so it's really funny, but it's such a good question because there is all of this stuff on social media about like phones are bad and blue light is bad, and I
Mhm.
think it's a lot more nuanced than that. So it's part of it is about the activity that you're doing on the phone or that you're just
Mhm.
doing in general. So if you are on your phone or on your computer and you're playing video games that are like really, really stimulate, like Wordle and stuff, like it's not like sucking you in and you're playing for hours, right? It's like a short time limited thing.
Mhm.
But if you're playing video games that are going to keep you up all night, or you're watching scary movies or true crime or things that are like really stimulating to your brain or disturbing, um, or people might be doing their work, they might be doing email, or if you're a college student like working on your paper, like I'll just do a little bit more. um,
Mhm.
those things are going to be stimulating and it's going to make it harder for you to sleep, versus if you're doing something that you find relaxing, like you find these little games relaxing and it's like a cue for you, like that okay, I'm going to do this and then I'm going to like settle in and like go to sleep. Or maybe you're watching a show that gets your mind off of things, because a lot of people have um, racing thoughts at night, or maybe a bit of anxiety, or they're worried about something and it's hard to stop thinking. Getting your mind off of those things, if it's like watching a show or like reading a book or something like that, that's perfectly okay, and in fact it can be really helpful, versus laying there and like your mind's going and you're worried and anxious, right? That's not
Mhm.
helpful. So
Yeah.
it's a balance. And I do recommend, if you are going to be using your phone or any type of screen, that you put the brightness on the lowest setting and then use the night shift feature if you have that on your device, so it's filtering out some of that blue light. So the bottom line is like it's not an absolute no-no, but it depends on how it affects you personally.
Hmm. I
Mhm.
imagine it's probably a good idea to turn off my notifications, because sometimes when I'm playing the games, then like notifications about an email that came in comes in, and then
Yeah.
then I just get sidetracked.
Yeah.
I have all notifications turned off on my phone because I just find them so distracting and like just it's not good for my nervous system. So I
Yeah.
don't even have them on at all.
Yeah. I definitely notice a difference between me doing like Wordle before I go to bed versus me watching TikTok before I go to bed. Like you said, like it's just like it's pulling me in and then I end up doing it for hours, and when I do my Wordle, I'm finished and then I just like, okay, like I'm done, I'm gonna go to bed and I feel good. and I'm not like stuck into something that I didn't like mean to be doing for 2 hours when I was supposed to be asleep. But yeah.
Exactly, exactly. And then, the other thing people need to remember is that platforms like TikTok, like any social media platform, they're designed to keep you scrolling. Like they are actually designed for you to not scroll, like to not go out of that app, right? And
Mm-hmm.
so it's like your brain gets hijacked by those
Yeah.
things. So the best thing is like just don't even go there. Like don't even look at it at night. Like just have a cutoff time for yourself where, after 8 p.m. or whatever makes sense for your schedule, like you just don't even go on social media.
Yeah.
I'm gonna have to share that with your younger sister.
Yeah, maybe.
Speaking of which, her younger sister, so my other daughter, she can sleep through anything. Like she can sleep through her alarm, um, us shaking her, like she can sleep through anything. And then when I was telling my family that we were going to bring you on, my brother-in-law brought up how he's having a hard time sleeping. And it made me wonder, because if you think like younger people can always sleep through anything and older people tend to wake up, is that a typical pattern? Like, do older people always have a harder time staying asleep compared to younger people? And is that an anxiety thing or what is that? And how is that related to age, if at all?
Yeah, so I kind of think of this in two ways. So one is your baseline sleep needs, and those do change with age. And then the second thing is sleep disorders. So for the first one, baseline sleep needs do decrease over time. So like if you look at a baby, they're sleeping most of the day, right? Like they're
Mm-hmm.
sleeping, like the majority of the time. By the time you get into adolescence, most people need like 10 hours of sleep. So, like, middle school, high school age kids, and then like even into college, you might need like 9 or 10 hours of sleep. Sometimes even a little bit more than that, depending on the individual. And then as we age, our sleep needs go down. So by the time people get into their like 40s, 50s, and beyond, they might need closer to like 7 hours of sleep. So there is that aspect. And then also like younger kids maybe like sleep a little bit more deeply versus, someone who's older. But then the second thing is sleep disorders. And there may be some sleep disorders that would be more likely to happen with age. So, for example, obstructive sleep apnea. I'll just preface this by saying that it happens in kids too. So, kids can have sleep apnea, teenagers and young adults can have it as well. But the risk of sleep apnea increases with age, especially in women, actually. So, like after menopause, that increases substantially. And that can impact a person's ability to fall asleep and stay asleep. So, it's not always anxiety related. Sometimes it can be, but there could be something else going on, like a sleep disorder. And then for someone who's younger, for people who need, if they're sleeping excessively or they're sleeping really deeply, like it's hard to get them up and like you're shaking them and they're like not getting up. I might wonder about things like circadian rhythm issue, like delayed sleep phase syndrome, which is something that I struggled with, especially more when I was younger. Like I could not get up in the morning for the life of me. So something like that. Or a more rare disorder, something like narcolepsy. Like it's not that common, but something to be on the lookout for people who are sleeping like long hours and they never feel refreshed. So that's kind of how I think about it in those two buckets: baseline sleep needs and then sleep disorders.
Why is it that older people need less sleep?
Yeah, it's just a function of over time. Now, having said that, like there are people where they might say, well, I can get by on 5 hours or 4 hours. And that's not really the case. Right. So, like, you might hear people bragging, like, oh, yeah, I don't need to sleep at all. Well, that's a very rare thing that someone can get by with 6 hours or less, like a short sleeper. We call those short sleepers. That's not that common. So, most people still will need like 6.5, 7 hours, and that stays pretty steady then, like once you get into your like later half of life, I suppose, if you want to say it like that. But
Mm-hmm.
um, yeah, so that decrease does happen. But for someone who's saying like, oh, I can only sleep 4 or 5 hours, or I only need 4 or 5 hours, that's not necessarily the case. And then I might look to see what's going on if they do have some kind of insomnia or if there's something else happening.
That's really interesting.
Nadia and I both think that we don't need that much sleep, but it's probably not
Well,
true.
I definitely need more sleep, but I've I've made the habit of being able to function on less sleep, but I definitely need it. Like actually this like last night, I like this whole past week I haven't been sleeping that much, and it's honestly I work I'm on co-op right now, so I'm working like 9 to 5 shifts, which is something I'm not used to, and I've never like chosen to wake up at 6 or 7 in the morning, which is like hard for me. It's hard for me to go to sleep early because I like going to bed later. That's just how, I don't know. I feel like that's what I'm used to. So now when I try to go to bed early, it doesn't work. Um, but last night I fell asleep at 8:30, and when I woke up in the morning for my shift, I actually like, I don't know, it's just it's a different feeling. I actually felt like I couldn't get up even more because I wanted to sleep like for the whole rest of the day. But I don't know. It's such an interesting thing.
Definitely. And, like so one thing that I think people don't often realize with sleep is there's a body clock that influences our sleep,
Hmm.
right? So it's not just about how many hours you're getting, but also the timing of it. And studies show that the more consistent a person's sleep schedule is, the better it is for their overall health. And in
Hmm.
fact, there was a recent study showing that having a consistent wake up time is better for overall health outcomes like heart disease, metabolic disease, and things like that than the actual amount of sleep that they're getting.
Oh,
And
interesting.
yeah, it's really interesting. And like Nadia, for someone like you, like what you were just describing, is you
Yeah.
probably have a bit more of a delayed body clock. So that's why
Right.
it's harder to fall asleep earlier and then it's harder to get up in the morning. That was the
Yeah.
issue that I
Yeah.
struggle with too.
Yeah.
But you can actually shift your body clock. But then the key is you want to be consistent with that.
Yeah.
Because then
Yeah.
if it's going back and forth, you're actually going to get more tired. And it creates this thing called social jet lag, which is just like the
Hmm.
jet lag you get when you're traveling, but you're not actually traveling. It's just like socially, you have a different schedule. So you
Yeah.
get the same kind of symptoms as you do with jet lag.
That's so interesting. Yeah, I think the going to bed part is not as consistent, but the waking up part, like it's not because I want to, but I'm forced to have to wake up at like these certain times. So that's been pretty consistent. And I'm interested to see like how it will affect me after. Like my co-op is 6 months, so I'm interested to see what happens after those 6 months. Um Maybe I'll always be waking up early after that. But
Nadia is working at a medical center. Is there anybody at your medical center that is a sleep specialist?
and not that I know of. I don't think so. I mean that would be really interesting if there was, but probably more so in the hospital than at the health center. But I did have a question about the effect of sleep and the appearance and just like I guess the overall look of my skin and hair. I know sometimes I notice that my skin breaks out when I'm not sleeping as much, but sometimes there's like other factors like I'm not sleeping as much because I'm studying for a test and I'm stressed and all that type of thing. Um, but I was wondering if there was a direct, connection between the two things.
Yeah, so there actually is. There is a connection between like the appearance of your skin and your hair and sleep quality. And like personally, I experience the same thing. Like I can tell, like if I look at a picture from some time ago, I can tell like, oh, I didn't get good sleep that at that time because yeah, my skin tends to break out and I can like just tell by looking at the quality of my skin, like, oh, I didn't get good quality sleep last night or I didn't get enough sleep. So there is a correlation. And there's a few reasons for this. One is sleep is a time of repair. So it's when our body, like we often think of sleep as being this kind of passive time, like you just pass out and like nothing happens for 7 hours or 8 hours. But
Yeah.
actually, there's a lot happening, and your body is going through this stage of repair. It's repairing your muscles and bones and other tissues, including the skin. So you get increased blood flow to the skin actually during sleep. And so that helps with the rejuvenation and improving like collagen. And there's actually studies showing that when people are sleep deprived, especially as we age, they tend to get more wrinkles and fine lines and things like this. Or it's harder for your
Interesting.
skin to repair itself from like UV damage. So if you have sun exposure and like some UV damage, your skin can repair some of that during sleep, because sleep is a time of repair and like immune activation. And the same goes for the hair. I think with the hair mechanism, I think it's related to stress. So when people aren't getting enough sleep, our body is in a state of stress, and that increases stress hormones like cortisol. And when there's increased stress, you're more likely to lose hair or like have hair thinning, or like the scalp isn't getting like enough blood flow and rejuvenation and repair, and a
Mm-hmm.
healthy scalp's important for healthy hair. So yeah, it's all connected.
Yeah. Oh, I really need to fix my my sleep. I feel like I can all a lot of things that I complain about with like my hair and my skin would probably be fixed if I
Well, there's a
had a
reason they call it
better.
beauty sleep, right?
Yeah, that is true. Yeah.
So, there are some like sleep, some supplements people often associate with getting better sleep. And the Christmas before, or the Christmas that Nadia started college, I think it was, I got vitamins for my girls. And the one that was for the college age kids had different things, one of which was melatonin. My mom saw it and she's like, "Hey, I heard melatonin's bad for young people." So then I wasn't sure. And then I looked it up. And then on a brief look, I see that it's somewhat controversial. So I'm just wondering what your thoughts are on teens and college age students taking melatonin or vitamin D or magnesium. Maybe those are three different questions, but those are all things that people associate with potentially getting better sleep. And knowing that these college age students probably aren't going to be convinced to go and get blood work done or try to see whether or not they're actually lacking in these nutrients. So, like, should they just take it, assuming that they need it? Or what are your thoughts on that?
Mm-hmm. Yeah, such a great question. Yeah, I think I probably get asked this like almost every day. So I think it's really, really relevant. Okay, so let's start with the melatonin question. So, melatonin, it is controversial because there's a couple of aspects to it. One is, what are you using it for? And then, if you are using it, is it a good quality supplement? So, I'll talk about quality just for a minute, because there have been some studies coming out recently showing that with over the counter melatonin supplements, you actually don't know what you're getting. There's two actually studies. There's one on gummies, and then there was another one on just like regular over the counter ones.
Hmm.
Um, where they found that some of those products either didn't even contain melatonin. They might have had other things in them like CBD or serotonin, things that weren't on the label. Or if they did have melatonin, it wasn't even close to the amount it said. Like it could have been like almost 500% more than what it said, or like way less than what it said on the label. So you really don't know what
Wow.
you're getting. So, what I recommend to people is first, if you're going to be taking melatonin, make sure it's a good quality supplement that's third party tested. And there's different, so if you just like Google third party tested, you can see the
Hmm.
different companies that do those third party certifications, and you can look for those insignias on the label of your product. So, that's number one. Like, don't just be taking a random one that you find at Target, because you don't know if it's actually has in it
Right.
what it says it does. So, that's the first thing.
Right.
How'd
Second
you know
thing,
I bought it at Target? That's
Yeah.
exactly where I bought her melatonin.
yeah. So, and you can get third party tested supplements at Target. So it's not to say don't buy any of them from Target, but just know what you're buying. Um,
Mm.
okay. So then the next thing is, what are you taking it for? So this is where it can get a little bit tricky, because there is a use for melatonin for certain types of conditions. It's actually not shown to be that effective for ongoing insomnia, except in certain cases. So, like for example, with kids with ADHD or kids with autism, it can be really helpful, or for kids with like certain other neurological type conditions. And then even in adults, it can be really helpful for body clock issues and other types of sleep issues. But it's not necessarily something that, you should be taking every day because you can't sleep. Because if that's the case, if you feel like you need to take something to sleep, then you need to go see a doctor to find out what's going
Yeah.
on with your sleep,
Yeah.
right? Like if you need an external sleep aid, then there's something more that's happening that needs to be addressed. So I do encourage people to think about that. Um, but, all things considered, of everything that a person could be taking, I'm actually not terribly concerned about melatonin, but just be mindful of the quality of it, why you're taking it. You want to make sure you're not masking, like avoiding getting treated for some other
Mm.
sleep issue. And then just be mindful too of side effects, because just because something is natural and over the counter doesn't mean that it's safe.
Mm.
So look out for vivid dreams, nightmares. Like I know personally, if I take melatonin, I'm going to have crazy dreams and I'm going to be really tired the next day. Like it
Oh,
just makes me really
interesting.
groggy. And so some people might be experiencing that and not even recognizing that it's from the melatonin. So I'll pause
Mm.
there and I can comment on the other supplements too.
Is sorry, I have a question. I actually don't really know. Do people take melatonin to help them go to sleep or to stay asleep? Like, is it for like the going to sleep aspect or so that they don't wake up during the night?
Yeah, such a great question. So it can kind of be used for both. So it can be helpful for people to fall asleep. It also does come in an extended release formulation that can be helpful to stay asleep. But even the immediate release can sometimes help people
Mm.
with maintaining sleep. But again, it has to be used for the right purpose, and in the right dose and the right formulation.
Yeah.
So, yeah, yeah. So there is a time and place for it, but it's not for everybody.
Okay. Thank you.
Yeah, and I can talk about the other
Yeah, about the
one.
Yeah.
magnesium and the vitamin
Yeah.
D.
Yeah, sure. Okay. So vitamin D is really important for lots of things, including sleep. It's important for bone health. It's important for gut health and energy levels, and of course, it has an impact on sleep and the circadian rhythm or the body clock. Vitamin D is one of those things where you can take too much. So I know you were saying like a lot of college students aren't necessarily going to go and get tested for it, but you can. Like you can go to your college health center. Most colleges have like a health center on campus, and you can go and get blood work done, and vitamin D levels can be checked. So you can take it in a targeted way to figure out exactly what dose you need. And
Mm.
then you can like adjust that according to what your levels are. So I think vitamin D is a really helpful supplement, and it's an easy test to do. So I do encourage people to get that tested. I do vitamin D testing on all of my patients, and it's really useful. And then for magnesium, you don't really need to test for magnesium. You can kind of assume that most of us are probably not getting enough magnesium in our diet. And there's a few reasons for that. Like the nutritional content of the soil is depleted. So we're just not getting as many nutrients in our food as we were like 50 or 100 years ago. And that includes magnesium. But you can also get magnesium from food. You don't necessarily need to take it in a supplement form, but you might have to eat more food to get your magnesium levels because of the nutrient depletion. Um, but no, magnesium's pretty safe. But again, like I recommend to people, like what we're trying to do with that is we're treating a insufficiency or deficiency. Like you don't want to be reaching for it thinking like, oh, I'm going to take this magnesium and it's going to make me sleep, because it doesn't exactly work
Mm.
that way.
Yeah. I I don't know if did you have a comment because I that just made me think of something that has like my roommates have been talking about recently, which is it's a drink on actually I didn't try it, but it's a drink that is popular on TikTok called the Sleepy Girl Mocktail, and I didn't realize it's like I actually don't really know all that. I think it's magnesium supplement and cherry some something and I don't know, but I didn't realize that magnesium was something that, people I don't know, use to go to sleep. Um but actually my roommates had mixed feelings on it. I know some of them did go to sleep like it was like, "Oh, that was really nice." And some of them are like, "I actually did not sleep well at all and I don't know if that helped. It just tastes good." Like I don't really know, but I think that was interesting to hear about just cuz I didn't know that was a supplement that was used for sleep in general.
Yeah, definitely. Yeah, the Sleepy Girl mocktail. So I think that's basically tart cherry juice and magnesium citrate powder.
Yeah.
And they mix it together with like some sparkling water, and it's like this little like sleepy
Yeah.
mocktail. And
Yeah.
actually, we're doing in a few weeks on March. I'm not sure when this episode's coming up, but on March 6th, is it the 16th? I believe. Yeah, the March 16th. Me and a group of women sleep doctors were doing like a pajama party for women.
Oh, that's
So you
so
guys are invited. Like
cute.
any woman who's interested in sleep, like you can come join us on Zoom, and we're going to be talking about stuff like this, like the Sleepy Girl mocktail, and should you wear
Yeah.
socks to bed, and like all of these social media trends on sleep. We're going to be talking about it.
Uh-huh.
We're all sleep docs, so you'll get the evidence. And just have fun, and like you can ask questions and interact with us. So yeah, feel free to
Yeah.
join us for that. But
That's so cute.
yeah, so it'll be fun. But magnesium citrate, yeah, like it's good for lots of things. It's good for constipation. So like for people who are struggling with constipation, it can help with regularity.
Mhm.
Um, but magnesium is also a good muscle relaxant. So for people who have anxiety or if you have muscle tension, aches and pains, and like Alyssa, you're physical therapist, so you see patients with these kinds of issues, magnesium can be helpful for that stuff. And so if it helps alleviate that tension, that can also help with sleep.
Oh, that's very interesting.
Okay, speaking of mocktails, what about cocktails? What are beverages? I mean, we know that coffee keeps you awake. Um, but what about other foods and beverages that could be detrimental to sleep?
Yeah. So you mentioned cocktails. So, of course, alcohol is a big one. And what alcohol does is it disrupts sleep architecture, specifically REM sleep or rapid eye movement sleep. So people might feel like, oh, I sleep better when I have a glass of wine or something, because it is a mild sedative and it's calming. So it helps people fall asleep faster. But then once they fall asleep, their quality of sleep isn't as good because their
Mhm.
sleep architecture is disrupted, and then they might actually be more tired the next day or just more groggy, or they don't feel as good, and then they might have more coffee to make up for that, right? So it becomes this vicious cycle where then they need a glass of wine to go to sleep or a cocktail, and then they have coffee during the day. So that's alcohol. But there's also an impact of food on sleep, and nutrition on sleep, and I find this area really fascinating. It's still kind of in its early stages as far as the research goes, but we do know that sugar has a negative impact on sleep. And so people who eat more sugar and less fiber in their diet, they tend to have less deep sleep and more awakenings throughout the night, more sleep disruptions. So that's one thing to be mindful of. And then on the other side of that, people who eat more fiber rich foods tend to have more deep sleep and better quality, more refreshing sleep. So I do encourage people to just start to notice, like, there's no hard and fast rules to this. Like I don't like to prescribe like, okay, this is what you should eat and this is what you should do for sleep,
Mhm.
because everyone's so different. So just start to pay attention to what works for you, how different things affect you. It's going to be different for me than for Nadia, right? So like everyone has their own unique biochemistry. So pay attention to what works for you. With the other aspect of nutrition, the timing of meals also has an impact. So, again, no hard and fast rules here, but generally speaking, you want to finish your largest meal about 3 hours before bed. But for people who struggle with staying asleep, sometimes that can be related to fluctuations in their blood sugar. So, having a high fiber snack about an hour before bedtime can sometimes help alleviate some of that. So, that could just look like, some veggies and hummus, or like a little bit of like an apple and nut butter or something like that. Just a small snack. So, again, like just pay attention and see what works for you and
Mhm.
like what makes you feel better and what makes you feel worse.
Yeah.
That might help my brother-in-law because he's doing intermittent fasting. So maybe he's like not getting that last bit of fiber. Like maybe he needs a little something because it's his blood sugar is dropping in the middle of his sleep.
Yeah.
Yeah.
I do think also, like, from when I was younger until now, obviously my diet has changed a lot. And when I was younger, maybe more in middle school, I would wake up a lot more during the night, whereas now I'm sleeping if I'm asleep, I'm usually asleep until my alarm goes off. So that's really interesting to think about, you know, all the different factors that go into that.
Yeah,
Yeah.
and I think just, adding to that, I mean, I could go on and on about sleep, so I'll just add another thing.
Until we go to sleep.
Yeah,
Yeah.
it's almost bedtime. But yeah, like the other thing is not expecting yourself to have perfect sleep every night, right? Because that just
Mhm.
doesn't exist. And I think aiming for that creates a lot of anxiety for people where they're like, okay, I have to set myself up for perfect sleep. So like we want to remove any rigidity where so for example, like I know that if I'm going out with friends and if I'm going to have a glass of wine, like I'm just not going to sleep as well that night, and that's okay. Like I'll
Yeah.
just factor that in. Or like if we're out at a nice restaurant and I want to have like, the decadent dessert or something, like
Mhm.
I know it's going to impact my sleep. Like that sugar is just not going to help me, but it's okay. Like I'm going to enjoy my life and
Mhm.
factor that into it. I'm not going to make a habit of it. Um, but you don't want to be so rigid that like you're not living your life, you know?
Yeah.
So I think
Yeah.
that's an important aspect of sleep too, because this is something that's supposed to nurture and support us, not be a source of anxiety and stress.
Yeah,
Totally.
that's such a good message for all the things that people are trying to like health hack, like there are so many
Mhm.
people paying attention to their watch telling them whether or not they're getting good sleep and whether or not their heart rate is ideal and just paying attention to how many
Yeah.
steps they're taking and just like
Yeah.
everything needing to be like, okay, check, check, check. I'm doing my life perfectly, and I like worried about it if I'm not.
Yeah.
So it's a good lesson for all aspects, not just sleep.
Definitely. Yeah.
Well, this has been really, really interesting, Dr. Bhopal. I'm so glad that we have got to have this talk with you right before bedtime. We'll have to think about it as I go to bed. Do you have any other questions, Nadia?
I don't. I mean, I think I've learned a lot during this talk. I learned a lot during with every speaker, but this was really interesting. So thank you for coming on today.
Oh, thanks for having me. This was so much fun.